Question about habits, smoking in this case, compulsive behavior. When the person cannot quite pinpoint what the origin of the problem is, or when you take medical history and there is nothing obvious, I can give you several tips of where to start or on which levels you might consider working. The first level, again, coming back to physiology and body first, because body needs to get stronger, is the level of the body. There are two treatments. One treatment is a very old treatment. It's called fear treatment on the face. This is something that we don't teach anymore in our professional training or any other training. If you're interested in learning this particular treatment, it's very short protocol. It's about 7 points, but it's extremely powerful and I love it really, really much and I use it a lot. We are coming into November. In November, I'm doing 15 minutes free consultations, Colourpuncture. So if you're interested in learning this particular protocol, connect with me and I would be happy to share this protocol because I think everybody needs to know it's fantastic. It starts on the level of kidney bladder, and then it is actually called fear treatment because fear emotion is emotion connected with kidney bladder on a level of emotion. And obviously any disturbances with urination, with reproduction, with our vitality, our chi itself, our longevity, it's all connected to the kidney system. So if you're interested in this, please connect and we can learn it. And together with fear treatment, I would use what is called spinal stroke. And spinal stroke is a treatment that everyone knows. This is probably in every book. This is probably in every training that you do. We're stroking the spine and we're stroking the bladder meridian around the spine, and then we're stroking sacrum, and then we stroking both sides coccyx. I once gave this treatment to somebody, and this is how I discovered this combination works. Then I did it for many other people. This is not a classic combination, but I was only starting, and I had this patient with both addiction. It was actually smoking on a physical level, but also on a psychological level, this was addiction to some kind of unrealistic expectations, and it manifested as non-available relationship in this particular sense for this person. And I thought, what can I do? Now, with a spinal stroke, remembering that spine is the sole axis, one of the indication for the spinal stroke treatment is you give it to somebody who you feel needs to stand on their own 2 feet more. And this could manifest on a very different level. Child starting school who really needs to stand on their own feet first time without parents. Or we can have somebody who, for example, is highly functioning, very, very grown up, but there is some level, at some level, there is immaturity. At some level, they didn't move on from some particular childhood age. So it may be that something happened, and not necessarily something happened like terrible psychological. Something happened like childhood disease, some severe flu, which created a lot of upheaval for the body. And very often what happens, some part of this person gets almost frozen at this stage. And sometimes you can really trace back origin of many diseases or many psychological problems to incidences like that. So I decided to do this combination. Every time there is addiction, there is also this connotation that we need this external resource to rely on, and without this external resource, and this resource could be smoking, it could be eating, it could be relationship, working, indulging into a lot of work as a means of escape. And so what this substance or what this activity does, it numbs us temporarily so we don't feel pain. And of course, it doesn't work long term because we end up with bigger problems, because while we are numbing ourselves with this, then our problems getting bigger, 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 and it doesn't work. So I did this treatment and the effect was remarkable. So the psychological issue was gone, and then smoking, and it was a beautiful story. Then I tried this combination for many people, and it really worked. It is to support kidney bladder system in any situation like that first. And very often this will be enough.